If you're living on Social Security and feel like your monthly check just isn't stretching as far as it used to, you're absolutely right, and you're not alone. In this video, we're going to uncover the truth about why Social Security's cost of living adjustment isn't keeping up with your real expenses, how the government calculates these increases, and most importantly, what you can do about it right now. Stay with me until the end, because I'll share specific resources and strategies that could help you save over $1,100 per year, plus the reform movements that could change everything for Social Security recipients. Welcome to Financial Area, where we break down complex financial topics into actionable insights you can use today. If this helps you, hit that like button and subscribe for more money-saving content. Let's start with something that millions of Social Security recipients are experiencing right now. You open your mailbox, see that annual notice about your cost of living adjustment, and maybe you feel a brief moment of relief. Your benefits are going up, but then you go to the grocery store, pay your utility bill, or fill up your gas tank, and reality hits hard. That increase? It's not even close to covering how much more everything actually costs. This isn't just your imagination, it's a documented crisis affecting millions of Americans who depend on Social Security as their primary or sole source of income. When we talk about Social Security, we're not just talking about a government program or monthly payments. We're talking about the foundation of financial security for over 67 million Americans. It's what keeps the lights on, puts food on the table, and covers those essential medical visits that become more frequent as we age. But here's what's really happening behind the scenes. A recent survey found that 80% of older Americans believed inflation was running higher than 3% last year. That's significantly above the official government figures used to calculate your cost of living adjustment. This isn't just a small discrepancy we're talking about. This is a massive gap between what the government says inflation is and what you're actually experiencing in your daily life. The real-world consequences of this disconnect are heartbreaking. Recipients are being forced to make impossible choices. Do you cut back on groceries to afford your medications? Do you skip a doctor's visit to pay the electric bill? Do you let necessary home repairs slide because there's simply not enough money left over? As one recipient perfectly captured it, "My check went up, but my groceries still went up more." That simple statement tells the entire story of what millions are facing right now. And it's not just about the financial strain. There's an emotional toll here that often gets overlooked. Social Security is supposed to provide stability and peace of mind. It's meant to be the reliable foundation you can count on after decades of hard work. When that system fails to keep up with reality, it doesn't just strain your budget. It undermines your sense of security and creates anxiety about the future. Now, to understand why this is happening, we need to look at how the government actually calculates your cost of living adjustment. Every year, your Social Security benefits are supposed to be adjusted to keep pace with inflation. The goal sounds simple enough. Make sure your purchasing power doesn't erode over time. But the reality of how this works is far more complicated and, frankly, flawed. The entire system hinges on something called the Consumer Price Index for urban wage earners and clerical workers, or CPI-W for short. This government index tracks changes in the prices of what they call a basket of common goods and services. Your COLA is calculated based on the percentage increase in this index from the third quarter of one year to the third quarter of the next year. Right now, the early estimate for next year's COLA is sitting around 2.5%. On paper, that might sound reasonable. But here's the fundamental problem that's been driving people crazy for years. The CPI-W is based on the spending habits of workers, not retirees. Think about that for a moment. The government is using the spending patterns of people who are still working to determine how much extra money retirees need. This creates a massive distortion in the numbers. Seniors typically spend a much larger portion of their income on healthcare, housing, and other essentials that often rise in price much faster than the general basket of goods the government tracks. While working, people might spend more on things like entertainment, dining out, or new clothes. Retirees are dealing with mounting medical bills, prescription costs, and home maintenance expenses that have been skyrocketing. But the problems with this system go even deeper. In recent years, federal agencies like the Bureau of Labor Statistics have faced hiring freezes and significant staff shortages. As a result, they've had to reduce in-person price data collection in several cities across the country. Instead of having people actually go out and record real prices, they're increasingly relying on estimates and mathematical models. Now, models can be useful tools, but they're not always accurate, especially when they fail to capture real, on-the-ground changes in costs. If someone is sitting in an office making educated guesses about price changes, instead of actually visiting stores and recording real prices, how confident can we be in those numbers? And if the data used to calculate your COLA is flawed from the start, then the resulting adjustments are going to fall short of what you actually need. There's also a timing problem that makes this whole situation even worse. Your COLA increases are locked in once a year based on data from just the third quarter. But what happens if inflation spikes later in the year? You're stuck waiting until the following October for any adjustment. That lag can leave you struggling to keep up with rising costs for months or even a full year. Let me put this in perspective with a real example. Let's say inflation jumps significantly in November, right after your COLA has already been calculated and announced. You're going to feel that increase in prices immediately in December, January, February, and all the way through the following September. But your Social Security check won't reflect that reality until October of the next year. That's nearly a full year of falling behind. So what can you actually do about this situation? The first step is understanding that you're not powerless here. There are concrete steps you can take right now to help bridge this gap and make your Social Security dollars stretch further. Start by tracking your monthly expenses closely, especially for essentials like food, housing, and healthcare. This might seem obvious, but many people don't realize exactly where their money is going or which categories are eating up more of their budget than they expected. Once you have a clear picture, you can identify areas where costs are rising fastest and plan accordingly. Next, and this is crucial, explore local resources that can help supplement your income. Most communities offer programs specifically designed to help seniors, but many people don't know they exist or don't think they qualify. We're talking about property tax exemptions that could save you hundreds or even thousands per year, energy assistance programs that can help with utility bills, and food support programs that can significantly reduce your grocery costs. Don't assume these programs are just for people in extreme poverty. Many have income limits that are higher than you might expect, and even small amounts of assistance can make a real difference in your monthly budget. Contact your local area agency on aging or senior center to find out what's available in your area. Here's something that could make an immediate impact on your finances. Medicare navigation services. Many people don't realize that they could be saving significant money on their Medicare plans. Services like Chapter connect you with licensed advisors who can compare every Medicare plan in your area. Their clients often save as much as $1,100 per year just by switching to more appropriate plans. They also provide ongoing support with a care advocate team, making it easier to manage your healthcare needs and costs throughout the year. There's also a tax benefit that many seniors miss. In the latest tax proposals, there's a $4,000 bump to the standard deduction specifically for seniors. While it's not a complete solution to the COLA problem, every bit of tax savings helps when you're living on a fixed income. But beyond these immediate steps, there's a larger conversation happening about reforming the entire system. Advocacy groups, economists, and lawmakers are pushing for significant changes that could make COLA more accurate and responsive to the needs of retirees. One of the most promising ideas is switching to a different inflation index altogether. Instead of the CPI-W, which tracks workers' spending, there's something called the Consumer Price Index for the Elderly, or CPI-E. This index specifically tracks the costs most relevant to seniors, particularly healthcare and housing costs. Adopting this measure could result in higher and more accurate COLA increases that actually reflect what you're spending money on. There are also ongoing discussions about tax reform. During his campaign, President Trump promised to eliminate taxes on Social Security benefits entirely. While this proposal didn't make it into current legislation, it's still being discussed. Any reduction in taxes on your Social Security benefits effectively increases your take-home income,